I'm Al McFarland. Welcome to the front room session at the Marcus Garvey House in North Minneapolis. Marcus Garvey House, headquarters for Insight News. And today we're going to begin a series of programs that look at the pressing issue of the day, the COVID-19 virus, coronavirus it's being called. And I am questioning how much discussion there is in our community, the impact of this pandemic on our community, the awareness of how we respond individually, collectively, as a neighborhood, as a community, and what we need to know and do. I'm concerned that we have an obligation as a newspaper and the communications company to ensure that the vantage point, the viewpoint, the assessment of the science comes with a cultural integrity that reflects our history, our presence, our predilection, but also our desire for a healing and healthful community. I'm pleased to be joined today to lead this series with a discussion with I call her the Chief Health Officer for our community, Stella Whitney-West. She's CEO of NorthPoint Health and Wellness. My colleague, Harry Colbert Jr., Managing Editor of Insight News, joins me in this interview with Ms. Whitney-West. Good morning. How are you?
I am doing well. Thank you, and good morning.
Good morning. Thank you for being here. And the topic is serious. And I have had this feeling, Stella Whitney-West, that I didn't hear the voices from our community, Black people in particular, but people of color in this community. And that's why I invited you to join me to say, what do you see from your vantage point as a healthcare provider? What are we doing in Hennepin County in North Minneapolis?
Well, thank you, Al, and you're right. I think that in our community, and certainly the people that NorthPoint serves in North Minneapolis, predominantly African American, but also Latino and Hmong, we find that there's always that challenge around communications and getting information out. That's why Insight News and the work that you do is so important. And you know that we work hand in hand with Hennepin County, and is one of the things that we constantly are aware of, and we remind the county. And the county is a lot more receptive now, understanding that how communication happens in communities of color is different. We go to trusted sources, and a lot of what we believe comes from those sources, and it can be Insight News, it can be NorthPoint, it can be people in the community, it can be relatives, and so we have to understand that and make sure that we are activating those trusted sources. We know that there, more so than ever, that there is a lot of misinformation out in the community. And we have to battle that as well. There's always a tendency for our community that if they don't see themselves, that they think that it doesn't impact us. And then there's that delayed response. And when there's a delayed response, by the time that there is some type of response, then it's at a heightened, it's almost beyond the 911 emergency. We're usually at the point where the tsunami, we're trying to stop the tsunami. So we're wanting to prevent that. I think NorthPoint, Pilot City, we've been in this community for over 52 years. We are a trusted point of care for the community. This morning, convened my leadership team. We've been meeting weekly. And today there was this added sense of urgency because of the declaration from first the governor, state of emergency, and then at the federal level as well, and then the closing of the schools. And so we now know, okay, we got to put this into overdrive.
Stella Whitney-West, let me ask you to back up for a second, because some people still may not be totally aware of the gravity of this issue. So I think we should start with kind of coronavirus 101. Let's set a baseline in this conversation so that people who are listening and watching on Facebook know where this conversation begins.
Okay.
And let me say to those who are listening on Facebook or Twitter or YouTube, if you like this conversation, like it, but we want you to share it as well. Our mission is to create a massive engagement, a massive conversation, a shift in the narrative in our community so that we become both conversant and therefore responsive in fighting the coronavirus, but also in moving toward the best health that we can have as a community and as a people. So
Yeah.
Stella Whitney-West, CEO of NorthPoint Health and Wellness, give us a baseline description of what we're dealing with coronavirus.
Sure. So, and this is called coronavirus 19. And so one of the things for people to be aware of is that there are other coronaviruses. This one, and they call it a novel virus, which means that it is new. This is the first time that we've seen this virus in humans, right? It started in the Wuhan province in China. They believe that it came from, and this happens and has happened before with viruses where there's a cross from animal to human. And that once it gets into the human population, then how is it spread? And I think what people should be aware of is that there's not a vaccine, if people know that. So that is why we are asking people and providing the information is that how do you protect yourself from becoming infected, right? And it's basic public health procedures, policies that people should follow about washing your hands. So this is a virus that you can contract it. It's not bloodborne, but it is airborne. So someone who is infected with that virus can carry it in their body secretions, their air through coughing, sneezing, and if you are too close or you are able to contract it that way, then you could easily become infected as well. So making sure that you are, so we're practicing what they call the social distancing, right? Which says that you should be at least 6 feet away from people, because if you're that distance, even if someone was to cough or to sneeze, the chances of the is pretty slim. Also, that the way, and we've been providing this information all along, and it's just good public health practice anyways, is that when you cough or sneeze, that, you know, into your arm.
Not your hands.
Not your hands.
Right.
And not only washing your hands, but washing your hands for that 20 seconds, right?
What's the difference? Why is that so important?
Well, that's important because you want to give time to make sure that you are rinsing and cleaning that virus off of your hands, the bacteria. And then follow up if you wish, because you can use either the hand sanitizer or you can use soap and water. Some people use both. You know, wash your hands really good. Make sure you're teaching your children and other people in your households to do the same. And then you can use a hand sanitizer. And then the other thing is that take a paper towel, or sometimes I'll have the sleeve to open the door, because people will wash their hands and then you go touch the doorknob. Well, okay, now you're right.
Compromised again.
You've compromised again. So, so that's how people can protect themselves from becoming infected, right?
One of the things that I know is recommended is to keep your hands off your face.
Keep your hands off your face.
And you'll notice, Stella, that at least 3 times already, I've been tempted to do my classic pose, because I usually lean my chin on my face or in my hands as part of my conversations pose. And so changing the habit is difficult.
It is very
And,
difficult.
and if somebody reaches a hand out to you, your natural feeling is to grab the hand. So
Right.
that's the conversation. We have to try to break that habit
Break that
and be
habit.
conscious. Right?
Absolutely.
And intentional, yeah.
Absolutely. And it's not disrespectful. I think that's what people sometimes feel like, oh, I don't want that person to think that I'm being disrespectful.
Right, yeah.
But it's a way of keeping ourselves healthy and keeping our community healthy. So it is a new normal, right? And that's what we've got to stress. At NorthPoint, and most people know that we are a primary care clinic. We are also a human social services. So we've got medical, dental, behavioral health services in our main clinic on Penn and Plymouth. And then we have 2 satellite clinics, one at 800 West Broadway and then one at the Cora McCorvey Center. So what we have put into practice right now is that we have a protocol, and it's the same protocol that we use. So this is not new for us in terms of dealing with a viral pandemic, right? So we did that H1N1
Right.
and the Ebola. So we have a protocol. So we want the community to know that we will, when you call for an appointment, when you present, we ask questions. And there are 3 basic questions that we ask. We want to know, number one, if you have a fever. You know, people have probably seen on TV where they've got these infrared thermometers where they're checking, because that's kind of a sign. If you have any respiratory symptoms, are you coughing, anything of that nature. And then have you traveled outside of the country? And there's high alert areas like Italy, certainly China, and Japan. They also then will also ask, or have you taken care of or been around someone who has tested positive and that is infected? And depending on if someone asks affirmative to those questions, then we the other protocol is that we will ask them to put on a mask. And then our staff will
And the mask is not so much to keep them from getting air issues, but to keep them from giving.
exactly.
Exactly. Yeah, okay.
Exactly. And then what we're also going to be doing, and again, this is unfolding as I speak, is I have a place where we will isolate people, and then where they can be further evaluated, and then a determination made if they so choose that they could be tested, or if depending on what their reason for coming into the clinic, sometimes if it's a procedure that can be delayed, then we will ask them.
Something elective, they called it.
Exactly, exactly. But those that are coming in for urgent treatment, or and for behavior health, we know that there's going to be a heightened sense of anxiety for people. We want to be able to see those folks, make sure that that they're in a good place, and that our psychologists, our social workers will work with them, because there's a lot of fear that people have. There's a lot of fear not only around getting infected with the virus, but this is as much of an economic pandemic as it is a health pandemic. And we know that if you are not able to go to work, and it's already a lot of people who are not able to go because they've closed down a lot of schools, a lot
Jobs,
of
businesses,
and so that whenever people are stressed out, that makes you even more susceptible,
Sure,
right?
sure.
So we want to be able to make sure that people are able to talk with someone that can help them understand and rationalize. Now, we know that there's some policies that are being put in place. And so we're trying to communicate that to folks as well, that the idea that if you are not able to go to work, that and you don't have sick leave, that will be covered. So that's a bill that we know is going in front of the U.S. Senate.
Yep.
So
The House has passed it, the Senate, and it's about an $8 billion bill to start with, but that still take a few days to get going. They want to assure people that they need not fear suffering
Right.
because they've been, their lifestyle has changed because of the requirement, because
Exactly.
schools can't take their children, or because they're a first responder and they gotta go. You all are first responders
Right.
up at NorthPoint,
Right.
and so your people have to come up to serve the population.
Right.
What if they have children that
Right.
now, that would normally be in school, that there's no school, what do you do? So that's a
Right.
big issue.
right.
Harry, is anybody, let people know how they can join us here, either if they have a question or a comment, what do they do? And we'd like to have people who are listening, if you have a question for Stella Whitney-West, CEO of NorthPoint Health and Wellness, to communicate to us via either Twitter or Facebook.
And basically, if anyone has any questions or comments, you can leave them in the comment section on our Facebook page or the Al McFarland Facebook page, and we can respond to those questions.
Great.
I'm monitoring the Facebook page for Insight News, so if you leave your comments or questions there, I can respond. And I believe you can respond via Al McFarland's Facebook page.
That'd be
Okay.
great.
Great, great. And so what is the plan? Oh, two questions, Stella Whitney-West. Number one, you're actually doing testing at NorthPoint.
Yes.
And that's a big issue because what we're hearing on television is how many millions of kits will be available, but at the present time, very few are available.
Right.
How many people have you tested, if you can say that, at NorthPoint? What do you have the capacity to do, and what do you expect will be the need in the near and midterm?
So let me just start off by saying that we currently, and because we're a small site, so we've currently have tested 11 individuals, and the good news is that they've been negative. There's one that we're waiting for, but we also know that there's going to be, as more and more people get tested, there are going to be some that are positive. We also want people to understand that just because you test positive for the virus, that does not mean that you're going to be severely ill. As the CDC guidelines, a good 80% of folks who contract the virus are not necessarily going to fall seriously ill. And what makes it high risk for a lot of folks is that if you have underlying health conditions, and particularly because this is a virus that attacks the lungs, the respiratory system, anybody that has a respiratory illness, it could be asthma, or if anyone is immunocompromised, that you are receiving therapy, so let's say a treatment for cancer, you are at risk.
Even diabetes, I understand, is
right.
a factor.
Diabetes, heart disease, because just being a diabetic, you tend to have, your immune system is somewhat compromised. And the same thing with heart disease, because the heart is connected with the lungs, the respiratory. So that puts you at an added risk. And then, of course, age puts you at that risk. And the reason is that because generally as we get older, you know, we're more at risk for a lot of the other diseases. So, but for the majority of people, does not mean that they're going to be severely ill. And that's why we want people to quarantine, right? And for a number of reasons. One is that when we look at the overall healthcare system, I think people who have been paying close attention have heard that the biggest concern we have is our capacity. If people have to be hospitalized, or how many respirators do we have, we want to make sure that we're in a position to take care of the folks that are the sickest and that need it, and where other folks can, if you can stay at home for that time period, that 14 days, and then your symptoms start to decrease. But they also request that you then get retested, because you want to make sure that that you
And I'm
get at least two
understanding from
negatives.
the television shows I've watched, they're requesting that you test at least 2 days in a row. And at one report, the doctor was saying 3 days. But the idea is a consistent test, because they can be negative and then be positive again the next day. So
Exactly,
yeah.
exactly,
So
exactly.
let me ask you, Stella Whitney-West, about the question of culture. And I started off by saying that I fear that there has not been enough dialogue or conversation or in my view, specific language around the impact of COVID-19, coronavirus, in the Black community. It concerns me because, you just described the groups that are more at risk, age and people with compromising underlying conditions. At the same time, we know we've had this discussion about health disparities in
Exactly.
America, and in Minnesota, North Minneapolis, this neighborhood has been ground zero
Right.
for health disparities for Black and people of color. And so the question is, where does the policy and information intersection exist where our response reflects this breadth of knowledge that we have about a compromised community? Compromised community suggests a preponderance or a larger number of people with conditions that are underlying, meaning more susceptibility. How do we both inform the community, but also move the public policy response to address this calamity? Is that a fair question?
It is definitely a fair question, and I would say that the community, number one, we need to hold our elected officials accountable, right? Because as decisions are being made about funding, not only how much funding or where the funding goes, we also want to hold them accountable to making sure that resources meet the needs of our particular cultural communities as well, and that they're seeing things or making decisions through that lens as well. I think organizations, media like Inside News and NorthPoint, we have a responsibility to our community as well, is to make sure at the tables and places that we are sitting at, that we always hold those policymakers accountable. We have a relationship with Hennepin County, and so I can say that at those tables that we are also doing that with the county. The county has a disparities reduction plan, and they have folks who, including NorthPoint and myself, who are making sure that that those resources are flowing into North Minneapolis. I think people should contact their state elected officials as well as folks in Congress. Send an email, let them know, because there's one thing that I know about elected officials, politicians. They respond when they get requests or information or any kind from their constituents. That is when they respond. So don't be shy about letting them know that you're concerned and you want to make sure that when they're making those decisions, that money appropriately and resources appropriately are coming to this community.
Let me ask you to close on this one thought. Stella Whitney-West, what role does culture play in addressing, assessing, resolving health priorities and health opportunities for a community, for a people? What do you think? And apply that to this particular challenge, if you would.
Oh, for sure. Well, it's front and center. We recognize that in healthcare, because healthcare and health, a lot of it is around cultural norms and beliefs, right? And when we're talking about a situation like this where we're trying to change behaviors, we're trying to have people change their behaviors so that they reduce their risk for infection. So a lot of the cultural behaviors that we have on how we greet people and how we touch people is based in our particular culture. And so now the recommendation is to reduce infection, that we have this 6 feet of social isolation, so to speak. And then for some people, it's like, whoa, that doesn't feel right to me, because I'm used to, when I come up, I want a hug, or I want to, I want a handshake. We even have different kinds of handshakes.
5-minute handshake.
Right. That's kind of our
culture.
calling, right? But then now they say, oh no, you got to do the elbow bump. It's like, oh, but so then how do we change the narrative? And we know that it's going to happen. I always look at our young people, the innovation and creativity that they come up with. And I know that, okay, if we're going to have to do some different kind of, they're going to put their own little
spin on it,
right?
Artful, yeah.
That's going to be particular to their culture, particular to youth culture, particular to our culture. And so that says that up front that it is important. I mean, we have made the decision in our expansion of our clinic that we are going to make space within our space for those cultural healers, those cultural rituals, because we know how important they are.
You told a story off camera before about when you were clearing out the corner of Plymouth and Penn, where Estes had been on the northwest corner. That before you could move very far, you were approached by some of the Hmong elders who said, our culture recognizes that a lot of pain and death has occurred right here, and before you move to do the renovation or the improvement, you need to address the souls that have an attachment to this place because of their funerals. Tell me about that.
Well, we were very, and I know I personally was very honored that the Hmong community felt comfortable and wanted us to be engaged in this cleansing ritual. And without hesitation, I said yes, because the way that they related to us, and it was a Hmong leader, a shaman, that said that their people would not come and would not seek health care if we didn't have this kind of cleansing or the release of these souls. So myself and some of our clinical leadership, it was early one morning. The shaman had set up the ritual for us. I had no idea, but I knew how important culture was. And so part of it was that it was a way, and the shaman, of course, spoke in their native language. We had an interpreter that was interpreting it for us, but it involved food. And we didn't even eat the food. The food was laid out on the table, and it was a certain number of 12, and the shaman would do different rituals and asking questions, and they were speaking to the souls. And one of the things, and I never forgot, at the end of the ritual, she said, "You have been given permission. You are now the owners of this space."
The souls have released
The
it.
souls have released it.
That's
to
amazing.
you.
And so it's a powerful story about culture and about the importance of culture. So today's issue of Insight News, and I'm going to talk about this after this podcast, I'm going to read a piece that I'm circulating. We're presenting an image and the suggestion that one thing that we might do in the Black community is promote the idea of a simple, respectful bow as the greeting of choice. You know, it's easy to hug, easy to handshake. We do it, we feel good about that, but we know that the circumstance of COVID-19 requires that we do things differently. So the question is, how do we marry the need to do something differently with something in tradition that has additional added value? And as I think about that, that's why I talked to artist Donald Walker, and he and I came up with this idea. We're presenting on the front page of Insight News today a suggestion in art that the greeting we should adopt as a people is an eyes open, gentle bow of the head. Now, and as you said, we do that all the
We do
time.
that
You're walking
now.
down the street, you're in a
Yeah.
crowded store, you make eye contact, you nod.
nod.
We do it anyway.
Yeah.
So what if we move that from an intuitive but into a protocol? And protocol is the key. What's the power of this? You know, we talked, and you talked, Stella Whitney-West, about young people and how they have this energy, this creativity, the vitality. And what if through this process, this challenge, and through the solution that we're seeking, we introduce new language and new habits so that the contact between young people and all people becomes a contact based on and reflecting the protocol of respect, the bow of the head,
Right.
right? So we practice respect
Right.
differently and publicly, and we have the additional mandate and benefit of responding properly to a threat that is potentially lethal.
Right.
So how do we do that? So that's where we're going to go. We want to try to present that as a suggestion for the adoption of a protocol that has impact on the immediate crisis, but also that recalls and reconnects to a legacy of respect in our culture.
I
Stella,
love it.
thank you.
I love it.
Okay.
It's great because for many of us, you know, this doesn't feel as, but if we can get something that's closer to us, our culture, you know, the
Yeah.
bow, the respect. So I'm looking forward to previewing it.
Great. Well, let's see. You want to give people a phone number or a website or address so that if they have questions about COVID-19 coronavirus or what we do as a community, what they should
Sure,
do?
sure.
If they need to be tested, how do they,
Sure.
how do they reach out?
So,
I asked
oh.
you about capacity. How many can you do? And what are you prepared to do?
Well, that I don't have the answer for right
Okay,
now. I will say that in the capacity for us is really limited because we have a short supply, and this is just across the country of masks. So one of the things that happened with the disruption in China, right, was the supply disruption. So when you look at, there's particular masks that we use, it's called the N95, that if we're going to be doing testing, that our staff
Has to have that.
And so we've got a limited supply of that. We're, all of our suppliers, back order. So we're connected with the county and doing a county-wide purchasing and trying to identify and really trying to make sure that we're distributing that supply. So that's why I can't really say what capacity that we have for doing the testing. But anybody that wants to be tested, we certainly can help to facilitate
Get it done
that
for them.
with our partners as
Certainly,
well.
certainly.
But we caution people that because, you know, we're not going to just recommend that anybody just go and get tested. We really want to make sure that we are utilizing the limited supplies that we have. So if you come in and you go through the screening, the clinical staff will make that recommendation that if you're high risk, and we need to have you tested.
Right.
Because once somebody knows that their status, then they can protect other people
yeah.
that they come in contact with or their family. So we want to be able to do that. So our phone number is 612-543-2500. It's a number into our call center, and people can call that to make an appointment. And then our website is northpointhealth.org. There'll be information on our website. We'll be updating it daily. We'll also, a trusted resource is certainly the Minnesota Department of Health. We're directing people there because we follow that and monitor that daily as well as the CDC website. So I think those are trusted sources that people can go to if they've got questions and they're a little bit unsure. We want to make sure that people know as well our food shelf. So we understand that in this time that food and other resources are going to be needed in our community. So our food shelf is looking at a way of how we can continue that distribution, making sure particularly people who are homebound can get food,
Right.
and other essentials, diapers, formula for babies. So we are gearing that up as well.
Great. Stella, thank you so much for being here. I'm going to close this with a bow. Thank you so much.
Thank you.
I'm Al McFarland. This is the front room session at the Marcus Garvey House. Thanks to Stella Whitney-West, CEO of NorthPoint Health and Wellness. We call her the Chief Medical Officer, Health Officer of our community, of our people. Stella, thank you. Harry, thank you for producing and arranging this. And finally, we want to do this on a daily basis. We think that part of changing the narrative is information, quality information, and we think our role, our mission is to make sure that you have access to analysis, information from people that you know, people that you trust, and who are able to frame the issue in language that resonates with you. It's a reflection of how important we feel you and your sensibilities are. We acknowledge you, we see you, we want you to share this conversation. I'm Al McFarland. We'll see you a little later on. Thank you.
Thank you.
Cool. Good, good, good.